Afternoon, and thank you for being here or for tuning in wherever you are. Yesterday, I announced that we believe that we're seeing early signs that the mitigation efforts are starting to pay off. And I don't want anybody to misunderstand what I said yesterday or what I'm saying today. We are seeing early signs that the curve is starting to flatten. But what this means is we have to continue to do those things that have caused the curve to flatten, that have caused the slowing of the spread of this virus and this disease. And that's the mitigation measures, the stay-at-home order, getting out only when absolutely necessary, and doing those things that are essential and not doing essential things every day. And when you do, practice social distancing. And now you're being encouraged to wear a mask when you have to get out and in close proximity to other people. Making sure you're following all the hygiene measures that we've been talking about all along, such as controlling your cough, such as washing your hands frequently with soap and water for 20 seconds, for using hand sanitizer, staying 6 feet away from people, and so forth. Now, we still cannot say with absolute confidence that the curve is flattening, but we are still seeing more evidence that we are moving in that direction. I would also remind people that our modeling and national modeling, and I know that everybody's paying attention to this these days, they are showing that we believe we're improving what the outcome is going to be. But all of that modeling is premised upon the assumption that we continue to effectively do the mitigation. And so if you want our numbers to spike, and I promise you they will, all we have to do is stop paying attention to, stop complying with the mitigation measures, and we're going to see our numbers spike right back up to where they were. And so it's really essential that the people of Louisiana hear this message and understand that just because we think we're starting to flatten the curve doesn't mean our job is over. And in fact, now is the time to double down. This is still going to be a very difficult week, and next week is going to be difficult. And I'm going to go over those numbers here in just a second. But I do want to tell the people of Louisiana, I appreciate those who are complying. And I think that we're getting more compliance over time, not less. We still know there are a lot of people in some regions of our state that, quite frankly, aren't doing as well as they should. And I'm encouraging them to do better and understand that this is a statewide problem, and there'll be some more information that will establish that pretty conclusively here in just a second. So as of noon today, we reported 1,417 new cases. So we now have 16,284 cases across the state. And I want to remind you all that every time we talk about a number, whether it's that number I just went over, 1,417 new cases or over 16,000 cases, we're always talking about our fellow Louisianans. These are human beings. These are our brothers and our sisters and so forth. And that should never be lost on any of us. Unfortunately, we are reporting today 70 new deaths. That is the highest number we have reported at any time in a 24-hour report. And remember, we're not saying that 70 people died in the last 24 hours, but that is the report that we have today, is that 70 new deaths have been attributed to COVID-19. Some of these people expired, and many of them, perhaps most of them, expired before yesterday, but the report just came in today because the testing finally confirmed that the individual had COVID-19. 519 patients are currently on ventilators. That's a big number, but it's actually a decrease yesterday from 552 patients. And what this reflects, we believe, is improvements in the way we are dispensing medical care in Louisiana and achieving better results with fewer people having to be placed on vents and people being able to come off vents a little earlier than we originally thought would be the case. And so I want to, again, thank the medical community out there, all those doctors, all those nurses, all the respiratory therapists, and everybody else associated with delivering health care in Louisiana currently under these very difficult conditions. And while the number of patients on vents went down, the number of patients in the hospital actually went up. We currently have 1,996 patients hospitalized across the state with COVID-19, and a number of others who are still under investigation. And I think that number is about 990 that are under investigation. In fact, you can see it there. They are in the hospital, and a large percentage of those are ultimately going to prove to be positive for COVID-19. I do want to make a correction regarding the number of hospitalizations we announced yesterday. There was a data reporting error, and the number of patients hospitalized yesterday was actually 1,981, and we reported a different number than that, and I apologize. We're taking steps to make sure that that does not happen again, because we are trying to be transparent, we're trying to be timely, and we're trying to be accurate. I mentioned yesterday that, and in fact this is the source of a lot of national news reporting right now, not just in Louisiana but around the country. We know that just over 70% of the COVID-19 related deaths in Louisiana are deaths of African Americans, while they make up 32 to 33% of our population. We are looking into this further and trying to figure out everything we can about that. For example, what percentage of overall cases do we think African Americans make up? What is the role of comorbidities in these deaths and so forth? And we have a lot more questions than we have answers at this time. I believe yesterday we may have been the first state to report on this, and we're trying to get more information, not less, and as soon as we have more, we're going to share that with you. We know that there are now confirmed cases in 63 of our 64 parishes. We added Cameron Parish today. Tensall is the only one out there without a confirmed positive case of COVID-19, but I can assure you it is in Tensall Parish, just as it is in every parish and every community. The virus and the disease is out there. This is truly a statewide public health emergency, and that's why we need everyone's cooperation all across the state of Louisiana. One of the bright spots in this is we have ramped up testing in Louisiana to a degree that, quite frankly, no other state has done. According to the information we have, we're now number one in the country in per capita testing. And I think that speaks volumes to the efforts that we have underway, led by the team at the Department of Health and Office of Public Health. And of course, Dr. Alex B. has been here with us every time that we've had one of these press conferences, and he's working hard every single day with his team. But I did want to point that out. And by the way, I don't say that because we're satisfied. We're not. We want a lot more testing, and we want a lot more testing in rural areas especially. We know we need more testing in the river parishes, and we're moving in that direction as well, and you may have some more questions about that. But I did want to point out that we have now administered more tests in the state of Louisiana per capita than anywhere else in the country. In fact, we're right at 75,000 tests now. A bright spot has also been the incredible report that we have received from businesses, neighbors, and nonprofits. To date, all 64 parishes have received PPE, and 126 medical facilities statewide have received supplies. I specifically want to thank Apple today and AmeriCorps for sending masks to our state. As promised by Tim Cook, the CEO of Apple, we received 400,000 masks last night and are in the process of distributing them. AmeriCorps transferred to us about 14,000 N95 masks this week as well. We are grateful for all the help that we are receiving, and we thank everyone for their generosity. Also, we want to encourage everyone to support our businesses, our Louisiana businesses, as much as possible. One way that you can do this is buying locally. And I joined Wildlife and Fisheries Secretary Jack Montesay and encourage everyone who's going to go out and buy seafood, purchase seafood that was caught in Louisiana by Louisiana fishermen or packaged here and produced here and that sort of thing. The state's fishing industry is still reeling from last year, which was particularly tough with the multiple openings of the Bonacary spillway and the floodwaters that put too much fresh water in certain areas of the state. So when you go out and purchase food, please think about spending a few dollars on seafood caught and produced here in Louisiana. Every dollar helps. And if you want to find out where you can purchase local seafood, you can go to louisianadirectseafood.com. louisianadirectseafood.com. From there, you can arrange local pickup, or you can have it shipped to your home. And before I take questions from the press, we're going to start something a little bit new today. We have a lot of people who are staying at home, and they have questions for me that, quite frankly, you're not asking. So we're going to start taking a few of their questions, and we're going to start today with taking two. So if members of the public, if you have questions that you want asked, please submit your questions to askjbe@la.gov. Askjbe@la.gov.